You have diabetes. To some, including my husband, those are three very life-altering words. Hello, my name is Kelly Morris, and today I will be demonstrating how to properly take your blood glucose or your blood sugar levels. The three most important basic steps that I'm going to be demonstrating are how to prepare the machine necessary to do so, how to extract your blood, and then how to read the results once you're finished. The first thing that you will need will be a glucometer. This is generally provided by your doctor via prescription. If in fact your insurance does not cover these, this is something that is sold over the counter at CVS, Walmart, Walgreens, places like that, fairly inexpensive. The second part to the glucometer that you will also need are the test strips. The yellow strip at the end of this test strip is what actually will absorb the blood once it's been extracted from your finger. The blood will then feed up through the test strip into the glucometer, where it will go through an internal centrifuge, for lack of a better term, and then give you the result of the amount of sugar within your blood. The final item that we will be using, and the fun one, is the lancet. This is kind of a fancy one, but it does encapsulate the needle that's required in order to prick your finger and withdraw the blood. Now, before I do that, I want to say that generally, for purposes of my speech, I'm using a baby wipe. Generally, you will use a alcohol pad or an alcohol swab and make sure that you clean the area that you intend to prick with the needle thoroughly. And then once you clean it, you then take the needle itself, or the lancet, and press it firmly against your finger. Preferably with myself, I use my non-predominant hand, and that way the skin tends to be not as thick. So then once you have it pressed firmly, you execute it, and there we have it. We have our blood now. At this point, what you're going to want to do is take your glucometer and the test strip and insert the test strip into the glucometer. This will automatically activate it and get it ready to read your blood. At that point, you will then take the glucometer itself and place it flush up against the blood, and it will absorb as such the blood up into the test strip. Once it does that, as you can see, now you have your results. This is the amount of sugar that's in your blood. My normal range is between 100 to 120, so I'm within my range now. So to summarize, the purpose of my speech today was to show the basic steps on how to take your blood sugar and eliminate the fear factor of the needle or the lancet part. I am not diabetic. I do have a fear of needles, and as you just saw, I have poked my finger now several times for this speech, and it doesn't necessarily get any less painful, but it is something that you become much more less fearful of doing the more that you do it. So hopefully, to summarize, I was able to teach someone who has been newly diagnosed with diabetes exactly how to do it, maybe reiterate some steps or some shortcuts that they may have forgot, and how to easily monitor their blood sugar. My last or final thought is this, is that by doing these three basic steps as needed or as prescribed by your doctor, that hopefully you'll be able to save your life. Thank you.